Ashley Cifuentes, and I'm going to be doing a trauma assessment for clinicals. I'm going to put on my PPE as I arrive to the scene. Before arriving to the scene, I am informed that fire and police have already cleared the scene for EMS personnel to assess patients. I am informed that I have one female patient. The scene is safe when I arrive. I'm able to go to treat her. The mechanism of injury is that she was in a car crash and the airbags exploded and hit her in the face and chest area. They safely pulled her from the car, the fire department, and my number of patients is 1. I do not need fire or police as they are on the scene already. I need to call an EMS at additional unit for advanced life support. My stabilization of the spine is considered. My general impression of the patient is that she's a 20-year-old female who looks to be not in any obvious pain. And she is pretty good for a patient who was just in a car crash. Her responsiveness level is she's alert. Her chief complaint is a little bit of leg pain and chest pain. She has no apparent life threats. Hi ma'am, my name is Ashley, I'm gonna be your EMT. Would you mind if I opened up your airway real quick? As there is a consideration for spinal, I'm gonna use the jaw thrust. Her airway is open and will stay open. I'm going to assess her breathing. Her breathing is present and equal on both sides. I'm going to insert an adjunct if it's needed, and it is not, so I will not be inserting an OPA or NPA. And her breathing is non-labored, so I will not be giving her oxygen therapy. She does not have any injuries that are very apparent and that compromise ventilation, so I do not need to attend to any. I'm gonna check her pulse and look for any bleeding. Her pulse is present and regular, and I do not see any obvious major bleeding, any bleeding at all, in fact. Her skin is pink, dry, and cool. I do not need to do shock management, and her priority is high just due to the fact that she was in a car accident. And I'm going to start conducting my exam while asking her sample and OPQ-RST. Hi ma'am, so I'm going to be doing an exam where I'm going to be feeling around certain parts of your body so that way I can make sure nothing is seriously wrong with you or that we may have missed something when we did our first look on you. And I'm going to be asking you some questions while I'm doing that. Is that okay with you?
Yes.
Okay, so I'm feeling her head for crepitus and deformations. I'm looking for her ears for any cerebrospinal fluid, nothing in her nose as I feel her face. No raccoon eyes, no JVD or tracheal deviation. I check her pupils for pearl. They are pearl. I start feeling her shoulders. So ma'am, are you allergic to anything?
No.
No? Okay. I'm gonna listen to your lung sounds now. They are present and equal. Pelvis is intact. Palpating your abdomen now. Are you taking any medications?
No.
Have you ever been in a car accident before?
No.
I'm gonna go ahead and feel her legs. I don't note any discoloration or deformations. Can you wiggle your toes for me? Can you tell me which toe I'm touching and squeezing? Okay, and I find a pulse. There is a pulse. I'm gonna find the pulse on her other toe. Good. Can you tell me which toe I'm touching and squeezing? Yes, ma'am. Can you wiggle your toes for me? Great. I'm gonna palpate the genitalia. Can you still wiggle your toes? Can you feel me squeezing your toe?
Yes.
And there's another pulse. I'm gonna start feeling her arm here. I'm gonna find her pulse here. It's present. Can you wiggle your hands for me? Which finger am I touching? Good, good. I'm gonna feel her other arm. Can you wiggle your fingers for me? Which finger am I touching? I'm gonna find a pulse. There's a pulse present. Okay. Now I'm going to log roll her. I'm gonna roll you over, okay? In 3, 2, 1. Before I log rolled her, I would have had my partner take cervical spine precautions. I'm gonna check her neck and her back for step-offs. I'm gonna palpate her butt, and then I'm going to feel her thighs, the lateral portion, to make sure there's nothing, as she did report leg pain. I'm going to log roll her back in 3, 2, 1. There you go. Okay. Now I'm going to ask her on her OPQ-RST. So on your leg pain and your chest pain, does it radiate anywhere else? Is it just your chest and just your leg, or does it spread anywhere?
Just the chest and leg.
Okay. On your chest pain, on a scale of 1 to 10, 1 being no pain or little pain, 10 being the worst pain you've ever felt in your life, how would you rate it?
7.
Okay. And on your leg pain, same question?
7.
Okay. So when your pain started, was it immediate or was it gradual? Okay. And on your chest pain, is it a stabbing pain? Is it a dull pain? Is it an ache?
It feels like there's pressure.
Pressure? Okay. And on your legs?
Like a stabbing pain.
Stabbing? Okay. Does anything make either of them better, worse?
I'm not sure. They still just hurt.
Okay, okay. And when did you last eat?
This morning.
And you said you weren't in a car accident before? Okay, and when was your last menstrual cycle?
Last month.
Okay. Perfect, perfect. And the events leading up to this, what caused the crash, do you know?
Stupid joggers.
Always out there. Okay. So I would manage her pain, and then I would comfort her and roll her, put her on the longboard to put her on the stretcher. I would apply a seat collar by measuring and applying the seat collar. Then I would get her into the ambulance and transport her. And I would reassess her every 15 minutes, because she is stable for now. And I would also For chest pain, I would, just in case, because it is chest pain, I would give her aspirin and I would start her on oxygen. 15 liters per minute.